Welcome to the Family Hubs Network's Developing Digital Tools and Improving Family Help. The webinar we've been planning for a long time. We're just about to get to the 101 participants. We've got a couple of hundred registered, so I think more are going to be joining. And for my first, you won't miss very much if you do. If you are a few minutes late, I'm just going to be setting the scene, giving the housekeeping, and the action will start in a few minutes. We are absolutely delighted that so many people are either here or have registered, and will be waiting for the link afterwards if they weren't able to make it. But we're not really surprised that there's so much interest in this subject, because it really is a hot topic. The whole issue of digital is, government are very interested in it, and lots of local authorities talked to us about it when we, very early, frankly, in lockdown, when we held some virtual round tables. And what was encouraging for us was that family hubs were really enabling swift adaptation as services, face-to-face services, had to close. There were a lot of challenges faced in local authority areas, and the urgency with which people had to change their ways of working and embrace digital tools absolutely meant that necessity was the mother of invention. And as I said, the whole kind of rise across the country of family hubs in many areas, we were told, look, family hubs have made our response easier, collectively, collaboratively. It's about corralling everyone together to work around similar objectives. People talked about how family hubs gave them the flexibility to do things differently and to respond very quickly. And just as an example, and this is all kind of very recent history, as you know, but we did have to change our work styles very quickly. Remote program delivery became absolutely the norm, whether that was in a small group format, whether that was one-to-one video calls, group video conferencing, as families arose as concerns about families arose, and there would be WhatsApping, all sorts of other platforms used to get in touch with people in actually quite an official, formal way, whereas before that would have been considered not the right way to go about things professionally, etc. So there's kind of we've all lived through a bit of a digital revolution, but what we've also lived through, which is very exciting for us, is that we're now in a place where family hubs are government policy. Local authorities across England are taking part in Department for Education projects. It's a family hubs unit in government in the Department for Education, and we're delighted that Mitesh has joined us as one of our participants. Sorry, one of our speakers today. Funding has become available to develop family hubs and integrated family services across the country. And again and again and again, we're hearing that digital tools are an essential feature of family hub models as they are being developed. And Catherine Barker, our head of development, who's going to be speaking first, will expand on this. And just to say that this event is very much the fruit of consultation with the many members in the Family Hubs network. There's been a real appetite for an event about digital tools where what people have learned, there's a real desire to learn from peers. And the topics we've chosen, they've been decided in consultation with our members, so that we're really touching into the specific areas of interest. And so we hope that this event, which is the culmination of a long process, as I've said, will both equip and inspire. So today, I'm just going to put a slide up with our running order. We're delighted, as I've said, contributors working in local authorities from across England, from Newcastle, Staffordshire, Nottinghamshire, Brent, Newham, London, and Frank Young from think tank Civitas. I've already mentioned Mitesh Mistry, who's the DFE team leader of Family Hubs Policy and Digital, the Family Hubs and Early Years Targeted Interventions Division, which is quite a long job title, who's going to be giving us a very welcome and brief overview of DfE's Family Hub's digital work. But before we get into that, I'm going to hand you over to Catherine Barker, who's the Head of Development at Family Hubs Network.
Thank you, Samantha. So, Family Hubs, they're all about giving families access to the right help at the right time. It's about prevention, helping families solve their problems and preventing problems from getting worse. So, if prevention is at our mission's heart, all families need to be able to access and receive help. So digital tools are a fundamental part of how we can achieve this. From on the one hand, ensuring we can offer families the very best yet sustainable universal offer, to finding new ways to reach and support those families who can be really difficult to reach. I expect here today we've got some very passionate early adopters of digital, whereas others are perhaps more cautious, concerned about the risks and the unforeseen consequences. But in reality, we need both mindsets as we develop a family help offer which optimizes the best of digital tools without losing the sight of the importance of physical, in-person interaction and experience. So before we hear from our fantastic speakers, I'd like to make a few points about the relevance and importance of digital tools in local family hubs. So next slide, please. Most of you will be familiar with the principles of family hubs, which we've developed over the years while we gathered evidence from local authorities as they evolved their family help services. So when family hubs became government policy in 2020, the Department for Education's Family Hubs policy team developed a family hub model framework, which reflected these principles. The framework specifies 3 pillars, which helpfully draw out 3 key themes: access, relationship, and connection. And I'm going to use these to structure some observations about digital tools from what we've learned in our conversations with local authorities and digital partners. So next slide, let's start with access. If families with children 0 to 19 and up to 25 with SEND are to access help, they need to be aware of it. Digital communication's got a fundamental role to play here in reaching, informing, and engaging with families. This means thinking about websites, the local council website, the Family Information Service, and perhaps a bespoke Family Hubs network website, as launched recently in the Isle of Wight, for example. It's about social media, and it's also about search engine optimization. Googling is many parents' first resort, and how high the local Family Hub network appears in internet search results makes the difference between being known about or not. Outreach to target groups can be facilitated by the skilled use of social media and search engine optimization, but also bespoke email campaigns. And Emma Roberts from Staffordshire is going to be talking to us more about those. And that brings us on to digital tools in the delivery of services. They will increase their accessibility for many. So regarding universal need, if all families can be aware of and access self-help digital resources to help themselves, then we can succeed in offering more families help early and preventing problems getting worse. For those who need help provided by professionals, such as group programs, virtual delivery can enable and encourage some hard-to-reach families to take part. And virtual delivery can also enable a local authority to deliver more families to more programs to more families. Joanne McIntosh from Bernardo's in Newcastle is going to be unpacking the pros and cons of these. Let's move on to the next slide, relationship. So relationship as a second pillar of family hubs is a reminder that digital cannot and should not replace in-person encounters. A relational culture is fundamental to the success of family hubs. It's about creating a system which exudes a relational approach, impacting the way professionals work together and how all families, not those that are getting family support, all families are received and helped. Digital tools can play a part in this. For example, during lockdown, we discovered how direct digital communication between practitioner and family can not only maintain connection, but facilitate relationships with the hard to reach, such as the mum who would not let any professional into her home until a dialogue by text message had built the trust between her and them, or the youth mentor who finally connected with a troubled adolescent through WhatsApp messaging. So for some of us, the protocols had prevented this kind of communication previously. But in a needs-must situation, new possibilities have been found. Prioritising the quality of relationships is also about helping parents maintain their relationship with each other. And the DWP's Reducing Parental Conflict funded projects, we've seen there how digital resources help couples who are struggling with the challenges of family life. If you can help parents to recognise the impact of conflict on their children and understand the triggers for conflict with someone they love, with help, many can improve their relationship with benefits for the children too. Let's move on to the last one, connection. The next slide, please. Sharing data is fundamental to enabling professionals to work together better in understanding a family's needs, providing effective and timely help, and measuring the impact and sharing the responsibility of the outcomes achieved. We're so pleased to have Mitesh Mistry here to update us on the Growing Up Well project, and also Simon Topping from Brent, who'll be talking to us about not just sharing data, but how a new online registration and booking system can facilitate connection between families and services with wide-ranging benefits. The relevance of digital tools to connection is also relevant in how professionals work together day in, day out, and virtual team meetings have become the norm. Irene Koukoulis in Nottinghamshire is going to be giving us more insight into this. So moving on to my last slide, to conclude, a blended or hybrid offer makes the best use of both digital and in-person services in a complementary way, facilitating a better universal offer and helping to engage those who can be difficult to reach in a cost-effective way. However, digital exclusion is a real challenge. We're going to be touching on this throughout. And other issues include the danger that digital resources might become the focus of a universal offer and even discourage families from accessing more support, or the financial investment needed. Frank Young of Civitas is going to be talking about some ideas here, but the financial investment required is a concern. And lastly, if we rely too heavily on some digital tools, we are likely to see the erosion of relationships rather than the enhancement of them. So I look forward to our speakers sharing their insight, and also encourage our attendees to use the chat to share their learnings as well as submit questions. Please do that. As a network, we really prize opportunities for collaboration and shared learning, and we hope that today is no exception. Thank you.
Thank you so much, Catherine. That was a really great overview and a great introduction, carefully woven in there to all the presentations that we've got. And I think one thing you touched on, which I touched on too, is how protocols almost dissolved in a needs must environment. And I'm very interested in what we will be putting into place as digital becomes business as usual. We've had quite a permissive, laissez-faire environment, I guess. And does that change when this becomes a much more common way of working, as I say, when we're out of that kind of emergency situation? So anyway, moving on, but I can't get too distracted. There's so much to get to, and I've already given Mitesh a bit of a shout out, so I'm going to hand straight over to him now from Department for Education. Thank you, Mitesh.
Thank you. So I'm Mitesh. I work in the Family Hubs policy team at the DFE, and I lead the policy for the Family Hubs Growing Up Well project. I'll be giving you a brief overview of the project, why we're doing it, what we're doing, and how it's been delivered. So as Catherine has set out, we believe Family Hubs are a way of joining up locally to improve services, access to services, the connections between families, professionals, services, and providers, and put relationships at the heart of family help. They bring together services for children of all ages with a great Start for Life offer at their core. Now, the Family Hubs Growing Up Well digital project is a cross-government endeavour that aims to further this by improving how professionals, primarily across education, health and social care services, collaborate and plan around families with children of all ages. The project was funded at Budget 2020 as part of the Treasury's Shared Outcomes Fund, which is supporting many projects across Whitehall to test innovative ways of working across the public sector to address complex policy challenges. So why are we doing this? There are many behind-the-scenes challenges to achieve our ambition for Family Hubs. Broadly speaking, the current service landscape for families and for 0 to 19-year-olds is fragmented and too often fails to mobilise state and non-state support around families in a cohesive and timely manner that prevents poor outcomes and escalating need. Families often have to retell their story to different professionals and cannot find a single access point, assessment and navigation of family services that directs them to the service across the myriad of needs that they might have, such as maternity services, support for SEND, mental health, housing, parental support, debt advice. So we see this project as a way of making progress on some of these knotty issues that local areas face in providing truly integrated services for families. So through this project, the DFE is partnering with 5 local authority areas. These are Bristol, Lancashire, Suffolk, Salford and Tower Hamlets, to develop some practical solutions informed by digital innovation to address 2 key challenges. The first being improving how information is shared between professionals across a range of services in a family hub. And the second key challenge we want to address is improving how families access and navigate services. It's also worth saying that we don't only want to focus on statutory services and other services offered at a local authority level. We want the voluntary and the community sector to play a central role in the family hub model and in the provision of services local for families and working as one team with the LA and other local partners. Now, we know that there are good examples of this already happening in many local areas, and we are engaging with a host of local authorities outside of this project to capture that good practice. In terms of how the project is being delivered, now, we are using an agile or iterative process that involves working closely with our local authority partners and frontline professionals in them areas across several stages to explore, develop, test and embed digital solutions. Now, to build a product or a solution that can be scaled up and rolled out nationally, the DFE is providing specialist embedded support to our local authority partners through business analysts, service designers and user and social researchers, and working as a mixed team to drive forward the project. And by doing so, this is allowing us to capture all learnings centrally. The 5 local authorities we are working with have quite different demographics, local circumstances, digital maturity, and are at different points in the Family Hub's transformation journey. Therefore, the diversity in local circumstances and the capacities they bring to the project will help us to develop solutions, digital solutions that address the diverse needs and can be replicated and scaled up so that they can be used by many local authorities across England. The project will not explicitly open family hubs in local areas, but we have the £12 million transformation fund and a further £82 million in the pipeline to support that. But should local authorities want to transform their local service model into a family hub model, the outputs from this project will provide them with the right tools to ensure that they are effective. We anticipate that the digital solutions or products developed could be made available in 2024 or sooner. And once we are in a more advanced position with the project, we will share our progress through the National Centre for Family Hubs run by the Anna Freud Centre for Children and Families. If you would like to speak to me or the team about the work that you're doing locally, we're more than happy to get in touch, so please let us know. I haven't provided an email on the slide, but it's project.growingupwell@education.gov.uk. Thank you.
That was really, really helpful, Mitesh, and I'm hoping that Poppy will get that email address onto the chat, or if she might come back to you and say, can you just check that one out? So we'll sort it either way. But what I'm hearing is that the government is really intelligently putting in support for family hubs development, and that kind of agile test and learn approach to scale up a product is very exciting. But I did also hear, again, excitingly really, that we don't just want statutory services involved, that the government's talking about a central role played by the voluntary and community sector and working as one team with the local authorities. These are incredibly helpful messages, Mitesh. I know that Mitesh may not be able to stay for the whole event, but hopefully through that email address, questions can get an answer if he doesn't manage to stay. Okay, so I'm just going to move on very quickly. Again, Simon Topping from the Wellbeing Centre at Brent is going to talk about their digital solutions for registration, booking, activities and attendance. Over to you, Simon. Thank you.
Thank you. So next slide, please. So I'm Simon Topping. I'm an operational manager in the Early Help Service, London Borough, Brent, and we're really kind of tight on time today. So I'm going to try and be really concise with the kind of the key messages. So next slide, please. So Brent started its Family Hub journey way back in 2019, following a wide range of community research and engagement with local residents and stakeholders through outcome-based reviews. It was recommended to have more hub-based service delivery in local communities to enable holistic support to address the needs of the whole family using a multi-agency partnership approach. The Family Hub approach had already been established by many other councils, and with others developing similar models at different stages of development at that time. It was also a need, sadly, to make further efficiency savings. And I kind of, just to make that clear, so this wasn't the case where we had lots of money to develop family hubs. We lost half of our funding approximately for children's centres, and it was a cost-saving measure. So we transformed 9 of 17 children's centres into 8 family wellbeing centres. We're calling them family wellbeing centres, not hubs. And those launched in the beginning of January 2021. The remaining children's centres were repurposed, but continue to offer some support services for families linked to the family wellbeing centres. Next slide, please. So what was the kind of the rationale for developing our digital tools? So the children's centre registration process was paper-based, and once completed required inputting into the eStart database. For context, we use the eStart database for our children's centres to capture and store data. Families were required to either phone or drop into the centre to book onto activities or services. And when families arrived at the centre, they were then required to sign into the building and then to register or sign the attendance sheet for the activity that they were accessing. This information then needed to be input into the eStart database system. So all this required lots of kind of business administration, time and resource. So in a reduction in our funding, approximately half meant that we were going to be reducing staffing levels, particularly those involved with kind of business administration support, which input all the information into eStart. So we wanted to create a more efficient process that was more cost effective and modernized and move away from kind of paper-based processes. What we found as well was that the information that reported from our eStart children's centre period was often out of date because of the line between the activity taking place and data entry. And this was further impacted by staff going off on holiday and having sickness. And sometimes there was inaccuracy in the way staff recorded information onto the eStart database. We are under a huge amount of pressure, like we all are, to evidence the work of our family hubs and centres. And we wanted to ensure that we continue to access resources and ensure their ongoing sustainability. Also, different departments within the council have their own login requirements to access different services, such as parking, council tax and housing. So the corporate team wanted a one council approach where residents had a single login to be able to access lots of different services from the council instead of separate logins. So there were many kind of risks involved in developing a new solution. If it would be ready on time for the launch of the centres, would it be within budget? We were relying on a lot of expertise from our digital transformation team, and from previous experience, these types of projects don't always go as planned. Next slide, please. So we're calling our digital tools the digital solution, and there's 3 parts to the digital solution. The first part being a digital registration process. So residents sign up for a Brent My account, and this is the one council approach for residents and families to access services from the council. So once that's set up, in terms of the kind of the benefits, it gives us real-time data with numbers of registrations by children and adults. We can confirm if a family is registered with a GP, dentist, or school. It enables analysis by different demographics to ensure we're getting access, the right families are accessing the right services in the right centres. And we can promote new services and activities via email or text functions as well. So the second part is a digital booking system where families can book onto activities online. The activities are agreed termly in advance and then published. The benefits of this, it gives us real-time data analysis by number of activities, the types of activities, and those attending activities, etc. It enables analysis of the data by different demographics. Families receive a text reminder the day before the activity is due to take place, and this has helped to reduce families that don't show up for activities or appointments. And families in particular areas can be targeted with specific information, so we can be really kind of local in terms of what we're kind of signposting families to. And then the third part is the digital signing in process. So families, when they arrive at the centre, they're asked to sign in using a tablet or kiosk, and this then registers them for the activity that they're accessing as well. And the benefits of this is real-time attendance and usage data is captured. Families can use the kiosk to book onto other activities, or they can change bookings and so on from the kiosks. The kiosks are used to sign in professionals coming into the centres to deliver activities. And just to kind of point out that families can register and book activities using a computer, a laptop, or a smartphone. So it's a web-based platform. Next slide, please. So how did it go? There were lots of challenges, and really within 8 minutes, I don't have time to talk about them all today. But I guess some of the kind of the key challenges were around the timescale to develop and implement the digital solution were much longer than we anticipated, and it had to be completed eventually in phases. The costs were much higher than originally budgeted for, and contingency funding was required. It was a really complex project, and we were heavily reliant on our digital transformation team to interpret and translate into tech speak what we kind of wanted to do, and then liaise with developers, software developers in another country. Trying to convert paper processes into digital processes is a much more complex task than you might think. So we had flow charts coming out of our ears, and to map the kind of the workflow, and there were lots of kind of exceptions to the rules that had to be considered and factored in as well. And actually changing the behavior of service users, and particularly staff, was more challenging than we anticipated. To begin with, staff hated the new processes, and dealing with all the change management stuff from doing things in a different way took a lot kind of longer and was harder work than we anticipated it being. So initially there was some negative feedback from parents because it was a new way of doing things. And I think we just have to appreciate, though, that change can be difficult for people at all levels. Consideration needed to be given to families impacted by digital poverty. And one of the speakers kind of touched on that earlier. Some of the most vulnerable families could be excluded because of the digital process through a lack of device or data or know-how. We also had to think about language barriers in Brent because we're one of the most diverse boroughs nationally and in London. And data reporting systems at that time were not accurate, and we just had to accept this. And the pandemic added also additional kind of unforeseen risks that we hadn't anticipated at that time. But in terms of successes, the digital solution launched, hooray, in 2021. So we have new families registering all the time.
Just less than a minute, Simon. Sorry to interrupt. Just
okay, I'm nearly finished. New families registering have been really positive. To date, we've had about 8,000 individuals registered, and there were approximately 50,000 recorded contacts with families over a 6-month period. The new Family Wellbeing Centre delivery model was implemented with less staff in business support, and the digital solution is coping well with all the changes. A priority for the council is supporting residents with digital inclusion. So just to kind of emphasise that this isn't the only way of doing things for families. They can still phone up, they can still show up at the centre, and they'll be very much supported with registration and booking. They don't need to be able to do it just solely through a laptop or a phone or whatever. New reporting systems were created which provide more flexibility to analyse data in different ways. And you know, with lockdown, we've all been there. We've had to adapt to new working practices, and actually it allowed us more time to kind of pilot the digital solution in phases and make adjustments in an agile way as we kind of went along. And it's not a finished product by any means. We're continuing to do kind of tweaks and adjustments here and there to make it more fit for purpose. I think those are the key messages, but thank you.
That was great, Simon. Thank you so much. I thought it was interesting that you talked. Sorry, so I got muted there accidentally. Interesting about continual tweaks, costs being higher, and I think we probably hear that from a lot of different councils who are on this journey. I want to move quickly on to Kirsty, who's the Early Years Strategic Lead at Newham Council. who's going to be talking about virtual assessments. Over to you, Kirsty. Thank you.
Thank you, and good afternoon all. Yeah, can I have the slides, please? Great. Yeah, that's me. Next slide. Thank you. Yeah, so as kind of been shared already very quickly.
What happened to that?
Of course, it would be me that happens to. Anyone who knows me. Yeah, so very quickly, as early people said, back in kind of March 2020, which feels like a lifetime ago, you know, my responsibility is also to oversee the kind of early years aspect, but also the commissioning of children's centres. We were really fortunate that our children's centres were all based in schools at that time, because the guidance allowed us to stay open. So I know that, you know, for others on the call, your circumstances may have been different, but we were able to keep open a kind of visual face-to-face centre the whole time. Although that was the case, we very quickly mobilised both the early help assessment tool and a health virtual assessment tool to ensure that families still receive the right help at the right time. During the lockdown, and it has continued, our referrals into our early help system quadrupled into the kind of children's centre referrals that are centralised in the borough. So we knew that we couldn't stop this service. It had to continue, and it had to continue at a rapid pace. So very quickly we mobilised a number of things. One of them was the kind of virtual safeguarding protocol. So we've done that jointly with social care. So we ensured that across the system, across children and young people services and our commission services, that there was one safeguarding protocol. Just to give you a context of what that meant, is if a family was undertaking a virtual assessment, the expectation, of course, and I'm happy to share some of this if people want to email me afterwards, of course, that we would try and have cameras where possible. And we had very clear guidance about the cameras, the use of people's phones, you know, so that kind of safeguarding both for staff and families. And we developed a clear protocol in partnership quite rapidly about that. And then also looking at if children weren't seen, so if there were kind of 3 interactions where children weren't seen, then a doorstep visit would take place. So we would always ask to hear the child, see the child. It was very clear in the script, so we did develop a kind of process in a script. If the child wasn't seen, or there was a reason, oh, the child's asleep, obviously if we were concerned we would go sooner, but the very clear process was on the 3rd time we would do a doorstep visit. There was very clear safeguarding process for staff around what a doorstep visit meant and how that would look. What we also done was looked at the continuation of the early help frameworks. We do have a practice framework for children's centres, and we adapted that to the virtual world. So we still maintained the timescale of 5 days from referral into first contact. And we also continue to QA, because we do commission our children's centres, to ensure that those kind of key safeguards that we put in place around our practice framework were kind of continued throughout the whole time. Regarding the virtual practice guidance, that's what I've referred to earlier. So that was best start in life. So that was both targeted and universal. So we were able to maintain a universal offer through groups, online groups. And again, we had very clear practice guidance and expectations of how to do that. And we would spot check that, the quality of that as well. There were challenges around access to relevant technology and programs. So very quickly, through a kind of tech improvement program, we had to ensure that everyone delivering virtual assessments were able to do that with the appropriate tech in place. And I think a really important point when I move on is the virtual keeping in touch contacts and the script. So keeping in touch, there was an expectation that all early years providers, even if they were closed or open, their key worker would keep in contact with the child at least once a week. And through that kind of virtual keeping in touch, again, if there are any concerns, they were linked straight into the Best Start in Life team. There was a clear script, which includes our Help Newham offer, because in Newham we were disproportionately impacted by COVID. And there was a whole script of support around kind of food, wraparound support, parenting befriending. We were able to mobilise a whole virtual offer. The parenting befriending was a phone line which children's centre staff ran for children up to 8. And we were able to do that quite quickly. I think we had all of that in place by May 2020. We also established a kind of online feedback tool with all families that access both the universal and targeted support. Next slide, please. Okay, very quickly, so I've got 3 minutes. So within our kind of health assessments, we were also able to go on to a virtual assessment tool. So a number of things our health team mobilised very quickly was a kind of business continuity plan, and there was a whole guidance around who should be priority for both face-to-face. As I'm sure many of you, kind of the health visiting service was pulled into different roles within the NHS. So to keep this system running, there was a priority system that was used that was very consistent across the borough. There was an individual family risk assessment which took into account multiple vulnerabilities, and again that was consistent using the information they hold as health visitors and also the wider early help system. We also had the use of the same clinical assessment template, so again it was available, and as part of the virtual assessment we were able to be flexible based on the parents' needs, so it's either kind of WhatsApp video, Zoom video, so we didn't just use one form of kind of program. It was really flexible to the family. And then we had the triple S guidance for targeted face-to-face, which is safe, sharp and sure, and that was a very clear guidance that if a face-to-face contact was required, then how we keep our staff and families safe whilst we do that. Can I have the next slide, please? So some strengths and challenges, so that we saw some real benefits. I think one of the kind of key benefits from the health service is the kind of did not attend, or do not attend, did not attend rates actually reduced. So we saw that some of our kind of mandatory health checks and the number of mandatory health checks actually increased during this period, which I think is brilliant for our most youngest children in Newham. All of the settings undertook keeping in touch calls, and because of that, the EYFS progress checks were also able to stay. So whilst DfE disapplied those during the first lockdown, we were able to retain those checks because we also had a large majority of our settings stay open. We had the development of virtual integrated reviews, so we very quickly merged our integrated reviews because our kind of checks continued. So we were able to establish that, and we've got a whole kind of protocol for how that's delivered. We continued our kind of early notification process for SEND, and again moved all of that onto virtual. We had a kind of the development of virtual parenting support programs, which enabled us to continue our reach and actually increased our reach for some of our, I would say, kind of our not harder to reach, but those families that may not have engaged in the past, especially some of our no recourse to public fund families. Some challenges very quickly. So challenges meeting the needs of families who experience inequalities. What I would say is that, for all of us here that do this as our day job, we knew that there were still families that were very forthcoming, who were confident and had their voice, and we still felt that those families that were really experiencing the most inequalities were still sometimes quiet, and that's something we know we need to continue to develop. Families newly arrived into the borough is a core challenge for us, and continues to be a challenge for us, and I'm sure for many, especially around London. Undertaking accurate reviews. I think there was an over reliance on parental and carers' views, especially kind of around the kind of health checks. And at times we're thinking that over reliance has maybe missed some opportunities, which I know there's kind of some national reports about. So again, it's something that we want to build upon about how we capture the child and those observations in a meaningful way. And then I think just ensuring good quality and consistency. I know my slides dropped off a little bit, but just to finish off, we're on a journey. Our biggest challenge is language barriers. We have over 140 languages spoken in Newham, so we know that the kind of the digital inclusion piece, which we'll come on to, I know is a continued challenge, but I think the fact that we were able to maintain a kind of virtual assessment versus a face-to-face has enabled us to still reach some of those families and definitely build upon what we've learned so far. Thank you everyone for listening.
Thank you so much, Kirsty, and a mea culpa at our end. The tech glitch at the beginning was not you. You did brilliantly. That was us, and I love the emphasis on hearing and seeing the child. And the reduction in the do not attend for health is such an important issue. I think Family Hubs can make a really big difference in what they do in that area. And language barriers, wow, you explained that really well. So we're a little bit behind, but that's partly because I'm so enthusiastic that I'm saying a bit in between. So everyone will still get their 8 minutes, I promise you. But we're going over now. We're going up to the Midlands. We're going to Nottinghamshire and speaking to Irene Kukulis about integrated working using digital tools. Thank you. Irene, I'm really sorry, our spotlighting is glitchy. If you can just start talking, then yeah, okay. Thank you. We'll hopefully get there, but just kick off. Thanks. There you go. There you are. Thank you.
Brilliant. Thank you. Thanks very much. Well, I have to say, so far I've written so many notes. We're certainly learning a lot already, and we're not even halfway through the event today. So I think that's the first thing to say, is we are not experts in using digital tools. But we do have people across our partnership who are. So, and I know there's a few of those actually on the webinar today, which is great. So yeah, I'm Irene. I work for Nottinghamshire County Council. I'm a head of service for early childhood services, and then within that, I'm also the Family Hub lead for Nottinghamshire, also lead for child poverty and early years duties. So as I've said already, we are not experts in this at all, but I wanted just to share some of the work that we've done and some of the challenges and how we're trying to overcome them. You'll see on this slide just a snapshot of some of the tools that we've got. The first 3 bubbles on the top are all part of our Not to Help Yourself website, which I'll mention. And I know we've got reducing parental conflict people on this webinar as well. The top left is our Relationships Really Matters section, which is in Not to Help Yourself. Well worth a look if anybody wants to see it. I think the key for us is working with our partners and working with families, and I'll talk about that in the next slide, please. Thank you. Don't panic, I'm not going to go through absolutely all of this. This is just to give a flavour of some of the work we do. Apps, websites, I've mentioned briefly already, virtual groups and so on. So again, it's really useful to hear from other areas about how they're doing things, and there's always room for improvement in the work that we do. I will talk about apps in the next slide, so I'll hang fire on that one at the moment. But certainly our website, something we are quite proud of, are the websites that we've developed locally. So Not to Help Yourself is a huge partnership platform. It's very much around self-help. And it has a fantastic parents and carers zone, information around volunteering and work. It is for all ages, and I think that's actually one of the benefits, in that we know our families come in all sorts of shapes and sizes. We have grandparents, we have all sorts, so it is useful and developed with families as well. Not Alone is new, and that focuses very much on emotional health and mental health for young people, and that was only launched a few months ago, and that covers Nottingham City Council area and Nottinghamshire County Council. If you're looking for something very funky that was developed with young people, do have a look at the C-Card scheme website. Lovely images and so on. And then we've also got the 3 Health for Under 5s, Health for Kids and Health for Teens. They are managed by our healthy family teams, which are run by our community health provider, Notts Healthcare Trust. And I mean, they're fantastic. They're purchased, but they've been localised. We run our virtual groups. Interesting, we've heard a little bit about virtual groups, and I've got some fantastic comments and quotes from parents, many of which love them. We know we've managed to engage dads more, people with childcare issues more. However, we also know that lots and lots of our parents would much prefer to have face-to-face. But we also use it as well for training and for volunteers, which is great. It's actually meant that lots of our services are more accessible. But you know, we've already mentioned the challenges, so we do need a mixture of those. As with other areas, we do have online forms. We have an early help assessment form. There's a request for service form for parents to fill in for our children's centre service, and we have a professional referral form. At the moment, these are just the bottom 2 are children's centres, so they are county council. The early help assessment form is multi-agency, and that's been embedded for quite a few years now. We also have texting services and a lot more to do here, and I'm loving the work in Brent, wasn't it? So I do want to have a look at that because there's more we can do. Again, Notts Healthcare Trust provide Chat Health and Parent Line, which are both texting services. Chat Health is for young people and Parent Line is for parents. Again, fantastic access there. People get a really quick response. As we know, there isn't always a school nurse in a school, for example, but actually young people do want health advice. So it works fantastically well. And then obviously we've got our social media platforms as well. If anybody is using TikTok, please let us know. We would love to use it in terms of videos and so on, but we're not quite sure at the moment because we do also realise they've probably got to be fairly amusing. So we'll figure out that as we go on. Next slide, please. Okay, so I've mentioned briefly some of our apps already. The one on the left is called Notts Next Steps. That was developed as part of our Care Leaver local offer. It took probably about a year to develop, and it came from a very high level board who wanted to publish our Care Leaver offer in a range of different ways. So it is on Notts Help Yourself as well, but also this app was developed with our care leavers, and it's great. What it has meant is that there's fewer requests made to their personal advisors. They're empowered to do some of the work themselves and find out information themselves, and some still need some hand holding in using it, but that's becoming more and more established across Nottinghamshire. The next one along is My Notts app, and that's one that's developed by the County Council. If I had my way, that would be much, much broader and would include a lot more partner services on there. So there is a link on there, children and families, but actually if you link on that, it just takes you to the County Council web pages. I think we've missed a trick, if I'm honest, and that's certainly something that we need to look at because it's a great app. It's got a lot more potential. We've got Mind of My Own, which is used especially with our looked after children. And then obviously we've got the national apps. I think our view is let's not reinvent the wheel. There are some amazing national apps around. Let's use them, let's promote them. And if we can localise them, we will do. The Baby Buddy app, I know many of you involved in sort of early childhood and early years will know about the Baby Buddy app. It's one that we are working with in Nottinghamshire. It's a large local authority area. We've got 2 local maternity neonatal systems. We have 3 acute trusts. We have 2 different health community providers. We have 1 local authority and 7 district councils. To try and get them all together to work on this sort of initiative can be quite challenging. However, we've managed to get the support for the Baby Buddy app, and there is a working group at the moment looking at localising that. And if we're successful in our transformation fund bid, we will be able to pay for it. So a little hint there to Mitesh. Right, next one, please. Thank you. This is the last slide, you'll be pleased to know. So we've mentioned already online referral forms. I think the challenge we have is there are a range of different access points and referral forms. Some people might say we need to streamline them, but actually we can't do that without talking to our families. Some of them may want a range of different ways to access services, and that's absolutely fine. So we are going to be doing a lot more work with our partners and families around looking at those referral points. We know, for example, our families need to just be able to walk in or pick up a phone. They don't want to have to be referred into a service, and family hubs won't be a referral only service at all. The universal elements of it are absolutely important, so it's got to be easy to access. We also have the integrated case management system challenges. So the County Council uses Mosaic. Many of you may use that. Our children's centre cases are on there, youth service and so on. However, access to it is a challenge for our partners. We are looking at the moment at having a read-only access, but the way we're trying to get away with that is to just make sure that all the partners around the table where we need to discuss families, whether it's team around the family meetings, but also joint allocation meetings where we are looking at the data that's already held on the system and what information people have so that we can allocate that family to the appropriate organisation or group. Virtual groups, I think we've mentioned enough already, really, but one of the comments that we had was very much around it's worked very differently, but it's been easier for me to access. They've enjoyed not having to travel. However, as many positive comments we get the same amount of negative comments. So one of them was, okay, but I struggle with looking at a screen for a really long time. And I think we all understand that as professionals. But if you're a parent trying to digest information, it can be a challenge. Digital inclusion, I know, has been touched on. It's such a huge issue for us. We are in, we have some huge rural areas as well in Nottinghamshire. We do have the Better Broadband scheme, which we're trying to establish across Nottinghamshire, including those rural areas. But the other thing, and the very practical thing that we can do in family hubs and across our partner agencies, is to make sure that they have access to a laptop as they come into a building, or some sort of IT. We know that smartphones, we assume everybody's got a smartphone. Many people do, but actually have they got access to the credit and the data to be able to access the Wi-Fi? And that's certainly what we're finding from the parents we're feeding back at the moment. They might have that smartphone, but we cannot assume that they will be able to pick that up. And we know, for example, a smartphone can be extremely difficult to use if you are applying for welfare, for childcare and so on. It's much easier on a tablet or on a laptop or PC.
I'm going to stop you there, Irene. It was so good at the end, because as I've been saying, I really want us to get into the meat of digital inclusion. So I didn't want to cut you off any earlier. And I really loved what you were saying, A, about engaging dads with virtual groups, and B, you just touched on that incredibly important element of universal access to family hubs. They have to be easy to access. They're not just where you get referred to. So anyway, I better move on. We've got Frank Young from Civitas, who's going to be talking about creating a national online family hub. Thanks, Frank.
Well, thank you very much. My name is Frank Young, and I lead the Children and Family Unit at Civitas. This is an entirely new research unit in Westminster, and we will be launching formally later on this year. But my job in simple terms is to lobby the government to do far more on family, not least because there is clearly so much going on across the country that we need to be supporting that work with gusto and enthusiasm. I have to say, I feel like something of an interloper in this conference. I'm one of the few people who doesn't do anything remotely useful to help people and help families in communities. So I feel rather embarrassed to be here, but I think what is very noticeable from the presentations so far is that we have moved from, we can move slides, by the way, we don't need to see my name. Thank you. What I think is very noticeable is that we are now moving into a period of delivery when it comes to family hubs. I've been attending these events for a number of years now, and we have quite clearly moved from discussing the concept of a family hub and what a family hub might do in a community, and we're now really focusing on the delivery. And I think there's every reason for government and local authorities, of course, to be absolutely ambitious for family support. I think it's easy to forget that for things like healthcare and education, we haven't always had in our history universal state-led provision, and I think the same journey can be travelled for family support, where one day we or our children or our grandchildren even have access to something called a family hub in the same way that they have access to a state school down their road or a GP practice in their community. That's my brief moment of pom-pomming for family hub. I encourage everyone to be enthusiastic about the concept. I think in terms of a vision for digital provision of family services, what we do know, and some of the research that I've done working for think tanks, is that parents are increasingly going online for information. One survey I did a few years ago of fathers found the emergence of what we called Google Dads. We discovered that over a 10-year period between 2006, 7 and 2016, 17, there was a fourfold increase in the number of new dads seeking parenting advice online. But I think crucially, one of the things we also discovered when we did this research is they wanted to go online to meet other parents too. And when we were looking at the provision of online services, that geolocation technology was particularly important to identify parents like you know, down your street who possibly have a baby or a child of a similar sort of age, who you could go and meet up with. I think one of the features of parenting, particularly in the early days and weeks and months, is potential loneliness and isolation, and being able to meet other parents is incredibly important. So I think now really is the time, and we've clearly seen today, for the government, I think, to take a lead in this area and to launch an online family hub, really to act as a digital front door, to extend and complement existing provision in your local area. And if we can move to the next slide, please. I think it's really important to recognise that if we're looking at what a national online family hub might do and what the vision for an online family hub might be, it's that it absolutely shouldn't replace what is being provided locally. It absolutely shouldn't be something that replicates what's already happening or is being delivered centrally. And shudder at the thought. But I think if we deliver a digital wrapper called an online family hub, I think language really matters here. And I think what we will find is that using that language of a family hub would embed the language of family hubs, and perhaps also stimulate expectations that everybody should have access to a family hub. This somewhat, and perhaps the civil servants in the room ought to cover their ears, this somewhat sort of puts a pressure on future governments to do far more in funding, supporting, evangelising for family hubs as a movement across the country. I think crucially, of course, the benefits of digital is that a national online family hub could provide a trusted go-to place, a trusted digital front door. It's much in the same way, perhaps, that too many of us, when we're feeling unwell, immediately go on our phones and onto the NHS app and try to diagnose ourselves with a health condition. And you know, the NHS app the NHS website is particularly good as a trusted resource, and a national online family hub would have that sort of that sense that it is trusted. And it could also be tailored and targeted to individual groups, individuals themselves, of course, so that you know what you see on your screen, on your phone, perhaps isn't the same thing as what your neighbour even might see on their screen or on their phone. A national online family hub could, of course, provide guidance and advice, but it's crucial that it is a gateway in. It would link to local support in the area and stimulate the local physical support rather than take away from it. And I think as a brand as well, it's important to recognise, and we've just seen this in the fantastic presentation from Nottinghamshire County Council, that this isn't just a boring old website either. You know, what really matters here is how people access the digital. So I was inspired by the talk of using TikTok, for example. It's slightly shudder at the thought, but it's providing apps, things that you look at on your phone, particularly if you have a newborn, and you know that time is precious, and you don't necessarily get a great deal of time to sit and look at a laptop. Making the digital really accessible for people, and where people go for their digital information. And I think my final point would be that we and government, in looking for the next stages in developing family hub policy, could be really ambitious for an online family hub by driving traffic through the online, using by making, for example, things like tax-free childcare and benefits that are received for looking out for children, through something called an online family hub, which forces you to walk through the digital door. I like many people, I access tax-free childcare for my children, and it is, without being rude, it's a very plain website. It is a very dull website, and I contrast that with perhaps, say, the experience I have when I log on to my bank account, and my bank is constantly popping up adverts and pressuring me to do something, to get a credit card or to access some service that they're offering. And I think the same vision could be had for an online family hub when I'm accessing tax-free childcare and perhaps other family benefits too. That would drive a huge audience to the online, and hopefully through physical front doors too in communities.
I'm going to stop you there, Frank. Sorry.
I'm going to shut up. Okay, thank you. Thank you very much.
Thank you so much. Really appreciate that. And Frank's been very modest because he was at the CSJ for 6 years at least. And would we be in a delivery phase without all the work the CSJ have done since 2007 to make sure family hubs are a priority in government? We've had some great kind of overviews of a whole range of services. Our last two presentations are kind of drilling in. So we've got Staffordshire talking about the Hungry Little Minds email campaign to reach parents of new babies and influence them. And then Barnardo's in Newcastle have adapted a group parenting program for virtual delivery. So you're kind of going from the overview to the more micro. And I'm really looking forward to hearing Emma Roberts in Staffordshire talking about Hungry Little Minds. Over to you, Emma.
Hello, everyone. It's been fascinating to hear what's going on out there, and some really interesting overviews of huge pieces of work. So what I'm going to talk about is an individual campaign. So as introduced, my name's Emma Roberts. I'm from the corporate communications team at Staffordshire County Council. And I'm going to talk to you about a drip email campaign we launched just over 12 months ago, called Hungry Little Minds, Staffordshire and Stoke-on-Trent. So if we go to the first slide, the campaigns team were tasked with creating a partnership campaign to support early communication development in preschool children. So this is children 0 to 5, and I think one of the big challenges initially was that this was funded by the Department for Education's Early Outcomes Fund to work in partnership with our neighbouring authority, Stoke-on-Trent City Council. So we brought together health, voluntary, social care and early learning partners to look at how we could influence the parents of 0 to 5-year-olds. And we actually decided to focus on 0 to 2-year-olds because we felt if we got in early, got in at the start, that's where we could have the biggest impact with the communications campaign. So to set the scene, and this is pretty standard across the country, in Staffordshire 25% of children, it's slightly higher in Stoke-on-Trent actually, who weren't reaching a good level of communication development by the time they started school. And these children, they weren't catching up, so that affects their behaviour and happiness at home as children, as well as jobs and health outcomes as adults. So we wanted to build on the work that the DFE had done nationally with their Hungry Little Minds campaign, which was really recognisable brand, and to influence parents at a really local level, really drill down right to the start in very local geographical areas right from birth. So if we go to the next slide. Thank you. We knew that the biggest influence on a child reaching their milestones is the parent. It's not about having special skills or expensive toys. It's about the chats, the talking, the reading that a parent does with the child from the moment they're born. And just kind of relates to a slide later on, but that is a picture of Betsy. Betsy was born on the day we had the initial kick-off meeting 2 years ago for the campaign. So a little bit more insight, we knew locally that children from low or no income families were more likely not to reach their communication milestones at 2, and importantly that children that do reach their milestones were more likely to have attended the social sessions, those the face-to-face in-person offer that existed. It was just getting people to, one, know about the sessions and to attend them. So that's sessions in children's centres, in our libraries, voluntary groups, health visitor appointments. We wanted to bring the whole offer together to engage parents. So it's just, I just wanted to be clear at the outset that this wasn't to replace face-to-face or in-person sessions. This was to complement it, and because we knew that some of the parents that we wanted to reach were really much more comfortable in the digital format than they actually found face-to-face quite confrontational, and we needed to kind of handhold them and nudge them to that place. So it was never intended to be a replacement for face-to-face activity. We did a lot of audience insight, which told us that to influence parents, we needed to provide regular information over time, so little nudges, and rather than expect them to browse separate websites to discover content, we needed to serve it up to them in one place, because the parents that we really wanted to reach, the low-income families, they, for whether it was a time issue, they just weren't self-serving, they weren't going and discovering content which was out there, they needed it to be served up to them. The other thing that we knew from the research that we did with the audience was that it needed to be easily accessible on a mobile device. Mobile device online content was their trusted source. So we looked at drip email as a channel. So nobody's talked about email, quite interestingly, yet, because we tend to think about apps and social media, and email's a bit forgotten. It's perhaps deemed a bit old-fashioned, but actually we found that most parents did have access to email, and that with email we could get all the analytics and information that we wanted about how parents were engaging with the campaign. So you think about a drip email, think about Couch to 5K or the smoking cessation programs. And it's a time-limited series of emails that kind of drip out one at a time that encourage people to take a tiny action that builds up to a big impact. So what followed was the development of an extremely complex drip email campaign. It's huge, and complex is written in bold in my notes because it was really complicated to get going with. So we pulled everyone together, the health visitors, early learning professionals, frontline staff, and we developed 52 age and stage emails. So that's one for every fortnight of the first 2 years of a child's life. So if we go to the next slide, sorry. So in total, there are 438 emails in the system, and this is because we have 9 different variations of each of the 52 emails. So parents choose their geographical location when they sign up. We're a big county and Stoke-on-Trent, so there's a lot of diversity within those districts. Each email contains a fact, a simple activity for parents to do at home, and an invitation to a local session. So we use an email system called GovDelivery. So that's a public sector email tool that we already had, and we plugged in the 438 emails into the system to automatically drip out in sequence. So what that means is a parent can join at any point, and from the day the baby's born, or maybe when their baby's 18 months old, and any point between 0 and 2, they can sign up and they'll get an age-appropriate email every 2 weeks until their child's 2. The emails are personalised with the baby's name and tailored content depending on the geographical location. So parents have to subscribe to the email. So obviously that was a challenge, first off, getting parents to sign up. The content isn't published anywhere else, and that's to really force parents down the route that we want to be able to measure them by. As a local authority, we actually register the birth of thousands of babies each year, so we capitalised on this by inviting parents who book an appointment online to register the baby's birth to sign up to the campaign. So I'd really recommend that people think about the statutory touch points you have already with parents and how you can use them to kind of share messages. I'm not going to lie, it was painful from a GDPR perspective. Yeah.
Sorry, you've got less than a minute, and I know you've got lots of lovely slides to go. So can you rattle through them, please? Because they look
so GDPR was really the biggest issue for us, but it was really we got there in the end with that. So I guess skip through to the next screen. So personalised is the big thing. We used a larger font than usual in all emails, so it's super easy to read on mobile, especially for parents that in our research have had a reading age as young as 9. And we partnered with BBC's Tiny Happy People as well, so that there's actually video in each email that demonstrates the activity. So I guess if we skip forward to the results, that's probably where we want to be. So within the first 6 months, we had over 2,000 parents sign up. We've got 3,459 parents signed up today. When I checked, 23% of these are from low-income families, and for context, 13% of all families in Staffordshire are low income. We've delivered, it's actually now 43,000 personalised emails with a high open rate, which shows the content's valued by the audience. And then the final slide, a recent subscriber survey showed 87% said they've been inspired by an email to try activity during the last month. And so just, very broadly, we were really thrilled with this response, because during a period when a lot of face-to-face services stopped, we were able to still keep contact with parents and influence, babies to reach their full potential, which is amazing. So that's a real wrap through the end. Sorry, but yeah.
Thank you, Emma. No, please don't apologise. You had so much to say because you're doing great things. So thank you again. And I loved what you said about using the statutory touch point. I think that's very, very interesting to government. We don't reinvent wheels, and we use what we're already doing. Final, Joanne has been sitting there very patiently. Joanne McIntosh, family partner at Barnardo's in Newcastle, will be talking about delivering parenting programs virtually. So hand over now to Joanne. Thank you.
Hi everyone, I'm Joanne. I work for, can you hear me okay? Sorry, it's just asking me to go mute myself. I work for Barnardo's and I'm based at the Newcastle East Community Family Hub. And I'm going to talk today about our delivering of parenting programs Incredible Years, which is the one that we run from baby age to toddlers. We do the basic program and the school age program. So if I could have the next slide, please. So first of all, just like to explain a little bit of background about what Incredible Years is. I've only worked for Barnardo's for the last year, so my only experience of delivering the parenting program is doing it virtually, but my colleagues have been doing this for a long time in a face-to-face setting. So it's been a real change for everybody, for the parents and for myself and my colleagues to get used to this new way of working. So first of all, we're going to look at what went well with delivering virtually. So as you can see here, we've got pictures. This is the Barnardo's logo, and we're looking at what went well. So the good retention was something that was a real positive, and we found that when people started the course, the majority of them stayed till the end and completed the course, and they could attend anywhere, which was a really good thing for our families. Like I know the families that I had doing it, sometimes they would be doing the school run and our session started at 10 o'clock in the morning, and they would possibly join with their headphones on their journey home from the school. So it was really good that they could then go home, settle down, make a cuppa, and they were still listening and partly participating in the beginning. And we found that participants could continue to attend the programme even when the children were off school poorly. It didn't make a difference. If they couldn't come into the centre, they could be at home with their children. All participants reported positive outcomes and achieved their goals set. And this has come from parent evaluations that we did at the end of the course. So we've been able to get this feedback firsthand from the parents that did the course. We've created a parenting programme Facebook group, and we invited all the families on our current waiting lists to join. So if you were hoping to do a parenting class in the future, you could go on the Facebook group and get to know people that had done it previously and look at what was going to be coming. And the purpose of this page is to offer advice to parents as well and provide a selection of handouts on a wide range of parenting issues. We also use this page to hold polls. So when families go on the page and they want to see what we have to offer, we sometimes do live sessions with a facilitator on specific topics. So they'll have an opportunity for parents to ask questions, share information, and inbox for a personal reply. Parents found they fully committed and engaged, and the group gelled really well. And I know the group that I had just earlier this year and towards the end of last year, they got on really well. And outside, they formed their own WhatsApp group. So when we weren't delivering the session, they could talk to each other throughout the week. And perhaps some of them had similar challenges with parenting, and they were able to communicate and keep in touch with each other. And they enjoyed coming to the group and knowing that they weren't the only ones struggling. They enjoyed all of it, the tips and the advice. And if parents and carers had children at home while participating in the session, we would provide like some activities for the children to do as well. And if I could have the next slide, please, that would be great. As well as focusing on the positives, we did have to look at some of the challenges and the negatives that came with delivering the parenting programme virtually. So parents sometimes did experience technical issues, which I'm sure we're all familiar with in this day and age, sometimes poor internet connection, and we'll have to just try and get past that when it happened. Sometimes in some of the sessions, participants can become emotional and upset during the session because we're talking about something really personal to them, their parenting, and that could be really challenging. I personally found that really hard if I could see that somebody was struggling over the screen and they were upset, because that is something that just isn't the same when you're not in the room with somebody. Some families remain on the waiting list due to being able to not access it virtually. They might not have suitable technology, they might not have internet access. And some participants found it harder to do role play virtually. I think if we had been doing it face to face in the centre, people might have found that a little bit easier to sort of act out a scenario where one was playing the role of parent and one was playing the role of child. And I think it's a bit harder to break the ice and do that on the screen sometimes. And some participants just didn't feel comfortable being on camera, and they would attend the sessions, but as much as we encourage the camera to be on, we did have to respect that some people didn't feel comfortable with that, not in every session. And some people were unable to access the course due to the handouts being too big and they couldn't download them from their email. But looking at those things that didn't go so well had to be part of the process, as well as focusing on what was positive. If I could have the next slide, please. This is looking at what we did to solve any of the issues. So the negatives that I just outlined there, for example, the role play sessions, in a group, the parents can be separated into little smaller groups. And would sometimes, like if we were doing it face to face, we would have actual toys for them and props, but on Zoom, this isn't an option. So we'd sometimes go into a room with a smaller group and build their confidence around the role play. We offered breakout rooms. So if it was quite obvious that somebody was becoming upset or emotional, facilitators can offer one-to-one support and talk to somebody privately in a breakout room. If a participant didn't want to be on camera, we obviously had the chat facility running, and we could check in with them regularly to see that they were okay and that they understood the programme, and that if they were being a bit quiet or didn't have the camera on, that everything was still okay. And as for the large handouts that people couldn't always access via email, we would offer a service of delivering them to their home address. And, you know, myself or one of my colleagues would go and hand deliver it so they could have an actual physical copy of what we were doing. If I could have the next slide, please. This is just looking, I'm just going to put my glasses on for this bit, it's quite small print. We provided a lot of evidence-based parent programs for parents to reduce challenging behaviours in children, to increase their social, emotional learning, self-control, and we support families to help them develop skills in effective praise and use of incentives, to establish predictable routines and rules to promote responsibilities and becoming confident in their effective limit setting. So due to COVID-19, reflecting on what we've learned and what we've done, we've had to be more creative, as this was a new way of delivery of incredible years. And it was a challenge for us and for the parents as well at times, looking at these barriers. We converted all discs and material onto USB sticks, and this helped address the issue regarding parents, carers not returning paperwork. So anything like GDPR evaluations, pre and post course questionnaires could all be done electronically. This was a new way of learning for all of us as staff, and all staff attended a webinar and a workshop with Dr. Caroline Webster Stratton, and that was a real privilege to actually be taught by her firsthand, because she's the founder of Incredible Years, and she gave the staff the opportunity to share their views and questions to ensure that we're delivering the programme with the fidelity of how she planned it to be. The group was purposely kept small just to gauge how comfortable the parents are in this environment, whereas face-to-face we may have had groups of 15, 20, we'd try to limit it to about 12 maximum when we do it virtually. And we've got some feedback here and some lovely quotes from parents that attended the session saying, "Thank you, I was having a bad day and you helped me. I never realised that other parents are going through what I am." And finally arrived, so I'm going to do some extra reading as I find the programme so helpful. And it's really good because, you know, it's the parents' voice that matter in all this and how they're finding it, whether it was delivered virtually or face-to-face. If I could have my final slide, please. Post-pandemic, we're looking at how we can apply our learning. Due to the parent evaluations we've had and the facilitators' preferences, we'll plan in the future to hopefully deliver face-to-face. However, where possible, if parents are unable to attend, we'll give them that opportunity to join online. So we've been doing this for some of our other classes in the centre. We'll have a room where parents can attend and we'll have a large screen. So we could get some parents that join us that way virtually. And we've changed the referral form to reflect virtual and face-to-face delivery where parents, carers can identify their preference. However, we have found the majority preference still is face-to-face. I hope this information's been helpful, and I have to say I've really enjoyed listening to everybody else's presentations today. So thank you for your time.
Thank you, Joanne. And I've got to admit, I have not done a very good job at timekeeping because everybody has had so much to say. And I've been just about to say 1 minute and then they've said something that I've thought, oh no, we need to hear this. Now, we've only got 10 minutes, but I think the key question that's been coming through a lot on the Q&A is basically about digital exclusion or enabling digital inclusion. So I'd love in the short Q&A that remains, how do we reach and provide services for those who cannot use digital services? Are there alternative processes? And we had a really interesting question which was about how to support children and families impacted by parental imprisonment, which is a real area of social exclusion. So I'm going to I want to start with Kirsty, who's particularly onto this, and then other people, if you can put other speakers put their hands up, then we can hopefully get through quite a few responses before we run out of time. Thank you.
Thanks. Yeah, and I'll be super quick. And following on from kind of Frank's use of kind of banks and what banks do actually. So one of the things we're really thinking about in Newham as part of our kind of family hub planning for the future is around the use of community connectors. They may not be called that, but that's what we're thinking. So if you think about back in kind of 2014, when kind of some high street banks were starting to think about how the elderly will use the apps because they didn't know how to, and how elderly would use online banking. What we've really been thinking about in Newham is how we use kind of our community. As I said, we've got 140 different languages, so the community members that will speak in multiple languages, and how we get our kind of digital eagles of Newham, which kind of Berkeley had in 2014, to go out into the community with the tech and really start to show families, especially where language is a barrier as well, how they can access the support they need. So I think that's one idea about building upon what we know works, you know, nationally in a kind of bank environment, and think about how in Newham we can do that better. So it's kind of community connectors is one thing. I think the importance, and I know Irene, you said it about Nottinghamshire, definitely Newham, it's not just about the devices. So, you know, lockdown, 2,000 devices delivered across the borough. And then we realised that the internet was a big issue and Wi-Fi was a massive issue, so we're back to square one. So in Newham we've launched, I think September 2021, the kind of, it's called Newham Sparks, and it's a kind of borough-wide initiative to think about how we really are a catalyst around kind of the data and digital world, and how we support some of our most disadvantaged residents, which we have many in Newham. And I think leading on to that, the real importance about this isn't just about children and young people service, this is about a whole partnership response across the council. So resident services, regeneration, community wealth building, space, environment. It is everybody's business. So within Newham, we've got the 15-minute neighbourhood approach, and as part of our family hubs model, it's really building against that 15-minute neighbourhood, how we can make sure everyone in the community has that. And I think lastly, just the importance of libraries. So again, we have a great infrastructure with our libraries. Any of our families and any of our residents can touch down in a library, and the libraries are trained to support our families to access the help and services they need. And just to add on to that, again, linking to the language barriers, libraries are such a massive resource. They can bring in books in different languages. They have access to such different resources that maybe some of us don't at the moment. So I think the importance of the use of libraries to break down some barriers and to access maybe different groups that we know some families won't come into family services, I just think is probably the fourth point I wanted to cover around that.
That's great. Thank you so much, Kirsty. And Simon, there are a couple of questions on the chat for you about digital inclusion / exclusion. Do you want to add anything to what Kirsty just said?
Yeah, and I think just in general, I think somebody made the point before that what we're not trying to do is to be exclusive with digital tools. I mean, it really is a tool to kind of help things. And really for us, it was about resource reduction and trying to kind of manage how we do things more kind of effectively and efficiently. I think we will always need some kind of an engagement, a face-to-face relationship approach with families, because I mean, in Brent, we get a lot of refugee families coming in. If you don't speak English, you have no clue how the education system or support system works, etc., etc. You're not really going to go online, I think, and kind of try and find the family hub and go and access services there digitally or whatever. You're relying on a kind of a partnership approach, and it really is a partnership approach to other professionals bringing in these families into the centres. And then once we make contact with them, we can support them with different ways with digital inclusion, whether it be a laptop or getting a dongle for the internet or whatever, upskilling them. So I think we just have to remember that these are tools. They're not exclusively replacing what we had previously. And in Brent, I think I said that we can have families quite often rock up to the centres and you know they haven't registered, they haven't booked onto an activity, but we'll support them to kind of with registration and with booking. And if they can't do that themselves, they can phone or they can just tell us and we'll book that for them whilst we try and put that support in place as well. So I think that's just quite important to note. It's not replacing completely what we were trying to do before with a relationship engagement approach. It's a tool to help us and help other families as well.
Thank you. That's great. And just, would anyone like to say anything about the children and families impacted by parental imprisonment? I know Bernardo's done a lot of work on this, but it might not be something Joanne's knows a lot about. But the particular question was for Irene, because she was so vocal about apps.
I wish we did have an app. I did see the question and thought, oh, if only. I mean, we do a lot of work around prisons and supporting families prior to somebody coming out of prison. We do that, but we haven't actually done anything around digital yet. But then that piece of work is fairly new. So I think we will look at it. I mean, obviously it's part of the family hub type arrangement, so we will look at it. So I'm really glad it came up, because it was something that hadn't even crossed my mind, if I'm honest.
Well, that is very honest. I think that we're going to have to. We could talk about this for a very long time, but what Irene's kind of finished on is something that has struck me again and again, which is this is very much a learning journey. Presenters talked about continual tweaks, and that sense that we're polishing and it is very agile, as Mitesh mentioned when he was talking about the government approach. So we might be coming to the end of this webinar, but it's about developing digital tools, not having some kind of static offer that we're aiming for. There's going to be, as soon as you exit this webinar, your email, you'll get an email asking for, there's just 2 questions, feedback, very light touch. It won't take you very long to fill in. It'd be grateful if you could fill that in. To answer many people's questions, yes, there'll be a link to the recording. Yes, we're going to put the presentations up on the website, and there'll be a kind of post-event page where there could be some other relevant content coming in. There's been a lot of questions that I think if we can gather some, if the exchange between the questionnaire and the local authority that they're asked to, if we can capture some of that, that would be great. So very grateful that people have engaged so well with the chat. And finally, obviously, very grateful to hear from all of our contributors today. As I said, it was their input and our exchange with them over months that meant that we could put on an event that we knew was going to really scratch where the itches were. Thank you to the team here, Family Hubs Network, outstanding support that they provide when we run these events. And but thank you so much to everybody who came and who's going to take this learning back to local authorities, to the voluntary sector, as Mitesh said, and to the think tanks and to government and civil society in general. Family Hubs it's a tide that is coming in, and we've got a long way to go, but we're very, very well established on the journey now. So thanks again to everyone who's come, and we'll see you again at a Family Hubs Network event, I hope.